Mr. Smith, my name's Alak. I'm one of the F1s. I'm one of the junior doctors.
Oh, you're right.
Hi, and this is my colleague Alice. She's another one of the doctors. How are you doing?
I've been working with the Academic Health Science Network for the North East and North Cumbria for several years now, trying to improve and maintain good quality AKI care across the region. And one of the things that we've realised is that a lot of the work linked to acute kidney injury is performed by newly qualified healthcare professionals, be they newly qualified doctors, newly qualified nurses, newly qualified pharmacists and so on. And when we've surveyed some of the students at the end of their training as healthcare professionals, we've identified that they feel very uncomfortable about acute kidney injury. They lack confidence, they feel poorly prepared about what it is, why it's important and how to recognise it and address it. Traditionally, renal medicine is taught in a rather complex way. A lot of focus is given to things like histopathology, different types of nephritides and things that people find a little bit inaccessible when they're training at university. And actually that format of renal learning doesn't lend itself well to the busy clinical environment where acute kidney injury occurs. And actually the fundamentals of acute kidney injury are fairly straightforward. And so really we decided that a simulation program would enable us to really address those priorities for newly qualified staff when they encounter patients at risk of, and indeed who have sustained acute kidney injury, by making it more simple and more accessible and more relevant to the actual work they're doing. So things like identifying that the blood pressure is low, identifying and working out which drugs they should be prescribed and withheld, and which fluids should be prescribed and how frequently and how quickly. Those are all fairly straightforward tasks, but they're tasks that are performed by newly qualified healthcare staff. And I think that a simulation environment allows us to focus on those key fundamentals that are vital to getting acute kidney injury managed in an optimal way.
So could we also start by getting a breast rate and a we've done heart rate already, and the BP, please, if that's okay.
So we set up 3 sim scenarios to try to simulate common contexts where acute kidney injury occurs or complicates a patient's care. The first one was a very common scenario where a patient has come in dehydrated or with sepsis. The second one was slightly more complex, where the patient's developed acute kidney injury in the complex of multi-organ dysfunction. And the third one, we wanted to look at patients who've had acute kidney injury in a previous hospital episode and then been readmitted, and look at the reasons why that readmission has occurred. Although we've been developing the acute kidney injury sim program here in Middlesbrough for some years now, it really took off during the COVID pandemic. And of course, the pandemic provided lots of challenges within the clinical environment, but also for medical education as well. So this was really good because we were able to maintain good quality medical education for our students, even during the circumstances of the pandemic.
I thought the session was really helpful for covering the most common scenarios we'll probably encounter as F1 doctors, and as well it kind of reassured me that I didn't have to always worry about referring to the renal team, and more of when to refer to them as to kind of jumping to the phone straight away to call for help.
I think playing it out in kind of a more realistic situation helped kind of gain a little bit of confidence, because I think AKIs and renal things in general are just quite a little bit scary for final year medical students. It all seems very complicated, so kind of bringing it down to the basics was very useful, I think.
We have done this as a study in tandem with the medical school, seeking their ethical approval to do this study, and our plan is to write this up and then look at whether it is something that could be generalised to other universities across the country to really try to improve acute kidney injury management by the newly qualified staff across the country.